how it is that you transform or the contribution that you do towards this area of surgery through your non-surgical procedures.
Where to get the surgery done? Is my insurance available? There are so many logistics things which we need to get arranged. When we came out from our corporate life, we started this platform known as Medagg Healthcare. It's started by two of us. General anesthesia, I have to go under an OT, under a knife, and have those stitches done. Because if I have to go through a TKR, a knee replacement, the post-care is quite some time. I have to go through a lot of physiotherapy exercises. I need somebody to be my side and take care of me when I'm going through these post-care treatment. But for this, I don't need anyone. The next day, I'm out walking.
Hi, welcome to Rashmi Conversations. Today I'm going to touch upon a topic which instills fears in everybody's heart, which is surgeries. The medical ecosystem has moved towards a lot of superior technologies and procedures in with robotics and non-surgical methods of correcting conditions that are critical to a patient's welfare. Today we are meeting a very interesting guest who pioneers in the area of non-surgical treatments for patients. Sumitha Karthik, welcome to the studio.
Thank you.
I'm very excited to have you here. In 2014, my father underwent aneurysm, and it was an open surgery, and it was very, very critical. The doctor did take a waiver from us, telling us that it is possible that he may not come off from the table because he was already in his 70s. I'm sure a lot of people watching this episode today must have undergone similar scenarios. I want to understand how it is that you transform or the contribution that you do towards this area of surgery through your non-surgical procedures. Please tell us about Medagg.
Thank you, Rashmi. Thanks for this platform, giving an opportunity to talk about our non-surgical procedures. So yes, as any startup, we also started with the concept of a hospital discovery platform, where we felt when a patient goes through surgery, as you rightly said, when your relative went through this procedure, there's a lot of emotional trauma which somebody goes through. At that point of time, running around with the logistics, running around what would be the cost, what would be, where to get the surgery done, is my insurance available? There are so many logistics things which we need to get arranged. One is that emotional trauma, and other thing is the logistics. So managing all these things becomes a little difficult for the family. So that's when, coming back from a healthcare background, I always felt like, what is that we can offer in this space? So is there something which we can do to, ease this hardship which they go through? When we came out from our corporate life, we started this platform known as Medagg Healthcare. It's started by two of us, myself, and I have another founder known as Ramesh Krishnan. So I co-founded this platform along with him. We were very interested in this space called aggregation, because at that point of time is when, Oyo, Swiggy, Zomato, these all platforms came, and these were all revolving around aggregation. So that's why we thought, why not in healthcare space? So that's how this Medagg was formed. Basically, it was coined by medical aggregation. So that's how this word Medagg came in. We felt, why can't we offer a platform where people have this liberty to select what hospital they want, what procedure they want, and what would be the cost, what would be the budget, is my insurance applicable, all these questions, if we can answer for them. So that's how we created a hospital discovery platform to begin with. Because when family is being told, yes, I need to go for a surgery, I can't visit each and every hospital to find out, is there an alternative available? Do I have to really go for a surgery? If yes, what is the budget? Is my insurance available? Is it, less when compared to the other hospital? There are so much of comparison which we need to do. Who is going to tell me all this? So that's how we started this platform. And as any startup goes through these course corrections, from say, where we were doing all procedures for all patients, we developed a passion towards this department called Interventional Radiology. We developed this niche among these procedures. So coming to non-surgical solutions, that's what we offer today in our platform. These procedures are mainly done by a team of doctors called Interventional Radiology. So, as we said, when the comparisons to be done, we as patients, I feel like, we should be given all choices available. Like, even if I have to go pick up a phone, I do so much of comparison. Then when it comes to healthcare, why not? Okay. So if somebody tells you, yes, you have to go through this, say, enlarged prostate, if somebody is suffering through an enlarged prostate and they have to go through a surgery, why the doctor is not able to tell that patient, yes, there is a surgery available which you need to go through, but there is also an option of a non surgical procedure. You can select between these two, but that never happens. Mainly for two reasons. The doctor does not want to lose his patient, or might be that he himself is not aware. So, what I'm trying to tell you here is this non surgical solution platform which we are offering, the lack of awareness is not only among the public, but even among the hospitals. There are a lot of hospitals today, and there are a lot of doctors today who don't even know that these procedures can be given as an alternative. And here is where we are looking to promote and create a lot of awareness about these procedures. So rightfully, a patient is given a choice of whether he wants to go through a surgery or not. It can be not only because of financial conditions. One, he might be not fit for the surgery, or he does not want to go through the surgery because there is nobody to take care of him post the surgery, because there are obviously stitches, number of days stay in the hospital. I don't have anybody to take care of, when I go through the surgery. So when all this can be alternated by a non-surgical, which are all daycare procedures, and is covered by insurance, why not? So that passion towards this department is what made us drive this platform, I would say. That's how we started.
So, when a patient opts for non surgical procedures, the recovery is that fast that everything can be done as a daycare procedure itself?
Yes, in fact, all our procedures are daycare procedures. It's just for the insurance purpose, as India says, insurance means you need to stay there at least for a night. That's how majority of the procedures, we ask the patient to stay overnight so that they can claim the insurance. Otherwise, they are all daycare procedures.
And what kind of procedures are covered in this? What's the scope of work per se, if I were to ask you?
Okay. See, when it comes to interventional radiology, there are a lot of procedures which these set of doctors can do. But in our platform, the top few procedures which we offer, if I have to give, list the top few procedures, they would be prostate artery embolization, because majority of the men above the age 50 or above a certain age, they go through this enlarged prostate. To talk about over here what we offer in our platform, I can begin with, say, prostate artery embolization. Majority of the men above age 50 or above a certain age, I would say, they all go through enlarged prostate, because of which they are not able to control the bladder, frequent urination, and a lot of other medical issues. One, the moment I get to know about this, my immediate reaction, and rightly so, is go meet a urologist, where they give a certain medication. If it's not treatable through medication, the next option is surgery. One, the moment surgery, as I earlier said, causes a lot of trauma. Yeah, I need to go through the surgery. The amount of stitches I have to.
Loss of working days from job.
Somebody has to take care of me, post surgery. There has to be somebody in the hospital. There are so many things which keeps running in my. So why not? There is an option, given to me. So that is where we here give them an option of prostate artery embolization, where it's a daycare procedures. I wouldn't want to go technically into any of these procedures because I'm not a doctor. So it wouldn't be right on me to, talk technically about the procedure. But, comparatively, where there's a stay of, 3-4 days, where I have to go through an, general anesthesia, I have to go under an OT, under a knife, and, have those stitches done. Why can't I get this done under a daycare procedure without any cut or sutures, without any general anesthesia? If I have an option available, why not? So that is what we are here to offer these patients. Second, women all, they go through these fibroids, because these fibroids, There is a lot of irregular periods, menstrual cramps. There are a lot of pain which they go through, married, unmarried women. And just imagine an unmarried woman who has fibroids and they have to go through a surgery, myomectomy or removal of these fibroids surgically. They are going to have the stitches and the scars over there. And as an unmarried woman, I wouldn't want to have all those. But am I given a solution of a non-surgical option over there? Still no. That is sad. So there is an option available called uterine artery embolization or uterine fibroid embolization, where there is an option of through embolization, they shrink these fibroids. And it's again a daycare procedure. I don't have to go through any stitches around that area. I don't have any scars over there. I am back to normal the next day.
So, you're saying you don't remove the fibroid, then what happens to the fibroid after?
As I said, technically, I wouldn't be able to answer this, but a little bit light if I have to throw on this would be through these arteries, they embolize those fibroids. So what happens is the blood flow to these fibroids reduces and the fibroid starts shrinking.
Right.
And slowly through the next cycle, these fibroids automatically come out. So that's what happens through this process. So there is no cut in your uterus to go and remove those fibroids. And also what happens is above a certain age, women above a certain age, say about 50 or 45, if they have these complications of fibroids, doctor says, why don't you get an hysterectomy done? It's very easy to remove the organ. But as a woman, we know we want to preserve the organ. Anybody would want to preserve the organ because through this organ, there are a lot of, hormones. There are a lot of hormones which is secreted through these organs, which is very important for the human body. So why to remove that organ when there's a solution available? Again, there's no lack of awareness. In fact, I have seen the staff of the hospital itself going through the procedure and coming to us and saying, I've been working in the healthcare industry for so many years. I didn't know there was a procedure available like this. And I had to go through, surgical removal of fibroids where I suffered so much because of the pain and the stitches which I had to go through. They themselves are not aware.
You guys have grown exponentially fast over the last 1 year. You have expanded across 2 states and over 9 cities. Where is this demand coming from? Is it coming from the hospitals, the doctors themselves, or the patients?
Actually, I'd say there's a lot of demand from the patient side because there is where the awareness is not there and they are not given the options. As I was talking about these 2 procedures, there are we all know infertility is on the rise. When it comes to infertility, IVF centers, the amount of IVF centers are growing today is because, again, the lack of knowledge. If there can be an option given to them. Men infertility, also there's a reason called varicocele. Varicocele embolization, there is an alternative which can be given to men instead of going through a surgery. Women, fallopian tube recanalization. Majority of the women don't get pregnant because there's a block in their fallopian tube. This tube blockage can be removed by an IR doctor, the interventional radiology doctor, through recanalization. It's a very simple procedure. In fact, it's just a daycare procedure. They get admitted in the morning and they are discharged in the night or even the next day, rather than going through a complicated laparoscopic procedure. Or when the procedure is not possible, they say, why don't you go for IVF? When I can give that woman a chance to conceive naturally, why not? Similarly, thyroid ablation. The thyroid nodules. In fact, it's breast nodules. A lot of women which are benign in nature, they can go through ablation. They don't have to go through, a cut surgery and have a scar around over there.
So these are the options that can really improve a patient's life.
Yeah.
What I want to understand, Sumitha, is whether you do it at your clinic or do the radiologists conduct these procedures at hospitals across India?
So as I said, the aggregation. So this is where we are at the aggregation space, because if I had to set up a cath lab, I had to hire a doctor, my limitation would be only to that particular center. What we want to do is we want to take this to pan India and create this awareness more and more with lots of other people. So what we do is we help the patients by giving this awareness and help them get connected to these doctors, which are close by to them. So we have tie-up with these hospitals and these doctors and help the patients get connected to those doctors, right from fixing up the appointments till their admission and till the discharge. So we, help the patient throughout in their journey. So when a patient calls us, with these queries, I've been offered a surgery, is there an option available for me? Then we go through the reports. We have a team of doctors with us. We go through these reports. We share those reports with this interventional radiology. Once if they say, yes, there is an option, alternative available for this, we can get an interventional radiology procedure done, then yes, we help fixing these appointments of these patients with the doctor and get this process done.
The patient's existing doctors, do they also be a part of this journey of the patient opting for a non-surgical option through your platform?
Majority of the times, I would say no. Because the main doctor, they would generally prefer surgery. If they have offered a patient a surgery, why will they, be a part of a non-surgical option? One. But there are certain procedures which is done along with these doctors. Say, for example, a fallopian tube recanalization. It's not only an interventional radiology is there, there's a gynecology is also present over there. During a prostate artery embolization, instead of a doctor, along with the interventional radiology, there is a urologist also sometimes present over there in case if he has any other complication. If it's a straightforward prostate artery embolization, the IR can do it themselves. Otherwise, the main doctors are also there present in case if any help is required. Otherwise, these procedures are taken care by the IR doctors themselves.
What is the adoption that you're seeing across hospitals in India today, considering this is quite a nascent technology or quite a nascent solution that is being introduced in the medical fraternity, among the medical fraternity today?
I would say there are very few hospitals who have started promoting these procedures. In fact, I can even proudly say that, we were that initial,
you nudged the ecosystem towards this.
Correct. There are few hospitals now who have also started promoting one or two procedures of this, not everything, but one or two procedures, which also is complementary to them. Say, for example, there are hospitals in India, in Chennai itself, where, say, if I am very good when it comes to ortho, and I have to say, suggest a lot of TKR, knee replacement. There are patients who wouldn't want a knee replacement. What if I have an interventional radiology along with me? I don't want a knee replacement. I can, immediately send them for at least to manage that pain as a geniculate artery embolization. There is an option which is available to manage that pain in certain grades of osteoarthritis. So I wouldn't say that all hospitals are against it. There are few hospitals who are doing this minimum of one or two procedures, but not all procedures, because I've been in healthcare. If I have to start promoting these department, rapidly, the main doctors will come and wonder what are we doing? We have been there for so long. If you're going to send all our cases to these departments, then what are we going to do? So for a hospital promoter, it becomes a little dicey to promote these procedures. So these department is always kept at the back end. But we as a neutral party, we don't have any competition. We don't have any, competition over here. So we are able to promote these doctors. And for hospitals, we give them a net new patient.
This is the first time I'm hearing that even osteoporosis, conditions like knee replacement can be, or the pain can be managed through a non-surgical. I know there's PRP and all of those, but this is something different.
So there are a lot of pain management when it comes to knee problem, but there's something called geniculate artery embolization for patient who goes through the grade 2 or 3 osteoarthritis. This can be given as an option. Provided if all the other conditions are met, this can be given as an option, which at least, helps them managing the pain. Because if I have to go through a TKR, a knee replacement, the post-care is, quite some time. I have to go through a lot of physiotherapy exercises. I need somebody to be my side and take care of me when I'm going through these, post-care treatment. But for this, I don't need anyone. The next day, I'm out walking.
You also spoke about varicose veins. Can you just shed some light on that?
So varicose vein, at least I would say it's quite common because it's a procedure which is done by vascular doctors and as well as interventional radiology. So that space is quite widely accepted, and there's a lot of awareness about varicose veins when compared to all these procedures, I would say.
Interesting. Apart from the fact that doctors are not or hospitals are not widely, adopted this, what are the other reasons for the lack of awareness in this ecosystem? Is this very widely used around the world?
It is, and it's not going to be, it's the time is not very far that, the knowledge and awareness about this non-surgical solutions is going to be, coming.
Why? What are the other reasons for the lack of awareness among consumers, among patients? You can talk about how abroad, it's very widely accepted. In India, it's just starting. We need more and more people talking about this. We need more and more radiologists talking about it. Interventional radiologists talking.
Yeah. Yeah, you answered that question, because in abroad, there are clinics around it. There are clinics around prostate artery embolization. There are clinics around only varicose vein. There are clinics just for fibroid embolization. So it's hugely practiced over there. It's just that our doctors are also not, coming out and talking about these procedures. But I would say we've come very far here. There are cities where these doctors have set up their own hospitals with a 10-bedded hospitals. Yes, so it's not just the hospitals where we used to have the single specialty of only ortho, only uro hospitals. There are hospitals now which is exclusively interventional too. There are in Hyderabad, there is in Bangalore, there are a few more other cities also. So it's not going to be very far that these interventional radiologists will come out and start out their own clinics, own hospitals. They just need one cath lab and 10 beds. That's it. For them to start promoting these procedures and start standing on their own.
And start educating consumers.
Yeah.
What are the other areas of medicine that you will be foraying into in the near future at Medagg, like cardio or other areas?
In fact, I would say we've just scratched the surface by just doing the peripheral procedures. Interventional radiology is also come into cancer and tumor space. There are a lot of procedures which is done in that space. We are also exploring and we are also trying to create a lot of awareness in that. Apart from interventional radiology, who does the peripheral, there is interventional cardiology, there is interventional neurologist. So what we are trying to create in this platform is about all this. But we haven't, I wouldn't say we have reached there. We are still at the peripheral stage. Interventional radiology's procedure is what we are promoting now. But very soon we would be starting very few procedures of interventional cardiology and interventional neurology too.
Interesting, Sumitha. Thank you so much. I mean, I think it was very informative, and there is really a lack of awareness. And if there is a way through Medagg that people can actually opt for an easier way to solve their medical issues, which makes recovery and recuperation also easier, I think it's fabulous, and I'm really glad that we had this conversation today. I'm sure a lot of people are going to be benefited from this conversation.
I would say not only the patients, I would want even the doctors, interventional radiology doctors also to be aware that there's a platform like this where they can tie up and promote their procedures, promote their expertise through this platform. Because for them, this is the first platform of its type which has aggregated these kind of non-surgical solutions. I'm sure we are not going to be the one. Time will, say there will be a lot more coming in and, there's going to be a competition. But today I would be glad to say that we are the first one to start this aggregation space of interventional radiology where we are aggregating these procedures. So, as you said, the demand only is not from the consumer or the patients. The demand is from the doctors too, because they also want to get associated platform like this so that they are able to promote their procedures, their awareness, their presence among the public in their own cities.
I hope more and more doctors come out and talk about this area of medicine, so that obviously many people will be aware of it, and it will make the lives of many people easier too. Thank you.
Thank you, Rashmi. Thank you, at least through this platform, let's see, if we are able to create an impact and an awareness among the people.